Thank you all for turning up tonight, because you've given up your time, and that's very important, I think, especially for a very important cause. I was in that audience 2 years ago listening to Professor Chinnery tell me all about rare diseases, but we'll come to that in just a moment. And I've got a lovely picture of him giving part of a lecture. So I'm going to tell you about a project that did start at that meeting 2 years ago, and it's called Impacts. It's about improving patient health in two diseases, or a group of diseases called SAPHO and CNO, and we'll come to what they are during the presentation. So I'm funded by NIHR, they pay my salary, and I'm also a rheumatologist here at the University of Cambridge and Addenbrooke's Hospital. So we've already had a bit of an introduction to rare diseases, but I'm going to just give you one infographic about them. I'm going to tell you about how our project began, a little bit about bridging health and social care in rare diseases. That is, after all, the theme of this year's Rare Disease Day. And I think it's particularly important given what is currently going on in our landscape. I'll tell you about SAPHO syndrome, which is the disease that I am interested in, and then where we are with the project and some things about the future. So, rare diseases affect 1 in 17 people, or less than 1 in 2,000 in the EU, which means that approximately 3.5 million people are affected. And while quite a few rare diseases can be life-shortening, many of them don't have a cure or any approved treatments. And I think one of the most important things is actually 2 in 3 people feel that it's very difficult to hold down paid employment. And actually 60% of patients feel that it held them back with attaining what they wanted to out of life. And I don't know how many of you saw the interview with Baroness Blackwood that was on Channel 4. She said one of the difficulties she had was that she had to go to so many appointments to see so many specialists that it was impacting her job. And I think we sometimes forget that, and we don't realize that the other side, once the patient has left our room, they have to do lots and lots of other things that don't just involve, for example, a rheumatologist or a physiotherapist. So this journey started actually 2 years yesterday, and here in a very poor photograph, because it was taken from my very old BlackBerry, you see, is Professor Chinnery telling me about what rare diseases were. And actually, I just moved to Cambridge about 20 days before that event. And so I didn't really know anybody here. But I saw that there was an event going on, but it was sold out. So I emailed Georgina behind me, and I said, would you mind letting me come along? I promise I'll turn up. And so she said, if you promise you'll turn up, then I'll let you come, because sometimes people aren't able to come. So I did, and I learned all about what was going on in Cambridge and rare disease, and I thought, well, maybe I'll be able to do something in this. And then a mother was in the audience. She couldn't be here tonight, unfortunately. And she said, what do you do if your daughter has a condition and it looks like there's nothing going on, or progress is slow, or I don't even know how to get in touch with people to move things forward? And I was allowed to answer from the audience. And I said, well, what you need to do is you need to find someone who's working in that vague area, and you go up to them and you tell them to do it. But tell them you'll help. Tell them that you'll help them with that journey. So she came up to me afterwards and said, thanks very much for your comments. She said, my daughter's got a condition called CRMO. Have you heard of it? And I said, yes, I have. It's chronic recurrent multifocal osteomyelitis, bone inflammation that affects multiple parts of your body that's caused by the immune system attacking it. And she said, rheumatologists look after that, don't they? And I said, well, yes, I've actually seen 2 people with it in my life so far. It affects about 1 in 100,000 people. And she said, fix it. So that's her daughter. Her daughter's Eloise. 13 years old, she got this condition and had lots of fever and pain, was unable to go to school. People thought that when she came up to hospital that she had a bacterial infection of the bone. She was put on antibiotics. But actually some very clever doctors who weren't here, they were in Hinchingbrook, figured out that that she didn't have an infection and actually referred her on to the pediatric rheumatologists. So we've been working together to co-develop some of this research, so I'm very grateful to them both. And we did an article with the Cambridge Independent, and this is what Eloise and Melika said, and I won't read them out, but they said that it becomes very difficult to juggle life. And it becomes quite easy to focus on Eloise, who needs to go to lots of appointments and needs to come up for monitoring and get bloods done, and almost forget their other son, Finn. And actually, Melika said that it's one of these things that she has to remember as a parent, that you have to keep a household together. You have to look after everyone, and they found that a challenge. So I think juggling care and daily life is hard, and a recent survey from a European rare disease organisation actually confirmed this, that a lot of people, 7 out of 10 people, had to stop their professional activity, and most people found it very difficult with just activities of daily living. And about 3,000 people responded to this survey across Europe. So I think it's a very timely and important theme that we have this year. So what are these diseases? Well, most rare diseases are actually acronyms or collections of symptoms. That's all they are. So SAPHO syndrome stands for all those things up there. It's a combination of bone, skin, and joint inflammation. And it just really says what it is in the tin, but that doesn't tell you what it is. So inflammatory bone diseases in general are pain, stiffness, warmth, inability to walk. These conditions probably affect more females than males, but we don't really know that. They probably affect younger people, but some of the mainly the studies haven't been done. And you also get a very bad pustular skin disease. And I'm actually going to ask you how many people it affects, which is why there's a question mark. And it looks like that. It looks like pustules over your hands and feet that make it very difficult to walk or use your hands. It's anterior chest wall or breastbone enlargement, which most of us don't even think about. We don't think about our collarbone, but actually it transmits a lot of our force when we're lifting things. And it involves thickening of the bones and swelling of the bones that's incredibly painful. So I'm going to ask you now, and you'll need your clickers here. How many people do you think SAPHO syndrome affects? Is it 1 in 100,000? Because I told you about CRMO, that was 1 in 100,000. But how many does SAPHO syndrome affect? So that's is it 1 in 100,000, 1 in 10, 1 in 1,000, or 1 in 100? And we've got up to, there we go. Good. There's more and more people coming, right. So quarter at 1 in 100,000, half at 1 in 10,000, and then a few in the others. It's 1 in 10,000. So just to put it into context, 1 in 100 is about the number of people who have rheumatoid arthritis in the UK. 1 in 1,000 is roughly the number of people who have lupus in the UK, roughly. It can sometimes be a bit rarer than that, depending on where you go. And then SAPHO syndrome sits at that level. So we've got lots of rheumatoid arthritis clinics. We've got some lupus clinics, but it's very rare outside of a tertiary centre to have a SAPHO clinic. And that's Wembley, 90,000 people. You're looking for 9 people in there, or you're looking for 1 person who might have CRMO. So where are we with the project? Because we're collecting patients together as part of the BioResource for all the reasons that Professor Chinnery told us. But everybody needs to help because we certainly don't have all the patients here. The purple marker is actually Cambridge. So we're open for recruitment and we're seeing people and bringing them in here at the moment. Anybody that's yellow on that map has said that they're going to take part. So most of these people are actually my friends, which helps. Because you just go to them and say, well, look, remember when I did that talk for you? Do you mind helping me out now? And do you know what they say? They say yes, which is great. So we've got people like Judith Bubbier who are opening up the Royal National Orthopaedic Hospital to recruitment. They've never done anything like the BioResource before, but they do have a SAPHO clinic, and they're bringing patients in. We've even got people from Northern Ireland, Adrian Pendleton, who said, we can't take part yet in the BioResource, we know that, but see when we can, we'll be ready. people like John Harvey from Inverness, who's got a couple of patients, has said, look, we'll do what we can. And so people are coming together, and we're gradually getting more and more places up and running. But what else are we doing apart from collecting patients? And sometimes what's really nice is seeing what the offshoots are from these projects. What else have you managed to build capacity or get people to do? And I'm working with other companies, many of whom are quite small, and some of whom are doing interesting things in the rare disease space and are trying to improve the journey for rare disease patients. Some of them, such as Apparito, who use wearables and app-based technology to capture important outcome measures. Public Health England, and you saw that this National Congenital Abnormality and Rare Disease Registration Service is one of the partners. And actually, just very recently, a job was advertised 2 days ago for a 1-year clinical fellow at the Royal National Orthopaedic Hospital in Stanmore. Part of the role there is to recruit the SAPHO and CRMO patients. And what's our aspirations for the future? Well, you'll know from what happened yesterday and the NHS long-term plan that we need to get better at dealing with lots of our diseases, chronic, rare, and we're going to do this in partnership with lots of other people. But from the new National Genomic Healthcare Strategy, there is going to be an individual responsible for care coordination, according to Baroness Blackwood. Alert cards are going to be used, and then there's also going to be improving transitional care for young people going through to adult services. And personalised management plans are going to be part of this, which is going to leverage on our expertise in genomics in this country, because we all are world experts in it, as well as in data science and artificial intelligence. And I know that these things seem like buzzwords, but they are going to get there. And finally, will we ever get to a situation where you get the diagnosis before your symptoms are present? And that is an aspiration right now, but I think it's important to dream, and it's important to work towards something like that. And it takes a village to do this, and you've seen some of these pictures, and all of these people are involved, and there's a fantastic picture of some of the people in the BioResource itself who are doing a lot of the work on these projects. There's been lots of people involved in this. I'd like to thank Eloise and Melika for asking the question. I'd like to thank Georgina for letting me come to that talk, actually, on that day at last minute, and lots of people from the rare disease community. It's in Cambridge, people say that if you want to do something, they'll help, and certainly that's what I've found. So if you want to get in touch, if you want to try and help out, if there's anything that you want to know, that's our details at the bottom. But I'd like to thank some other people in the audience. So these are my family. And they're really important to me. And I wouldn't be here without them. So thank you.